will be discussing the ketogenic diet for my week 5 video digest. The ketogenic diet is a diet that is very high in fat, low in carbohydrates with moderate protein intake. To describe a typical ketogenic breakfast, that would include butter, heavy cream, eggs with some onions as well as cheese. To describe a ketogenic lunch, that would include chicken breast with some celery as well as greens, some green salad, and olive oil, lots of olive oil, and ranch dressing. To describe a ketogenic dinner, that would include a homemade steak with some avocados, olive oil, heavy cream, and with broccoli. Now, the ketogenic diet is a diet that works like starvation. Usually, when the body is lacking glucose, the liver would begin to use up the fat in the body and turn the fat into fatty acids as well as ketones. And so, to describe the effects of a ketogenic diet on the body, I would be discussing its neuroprotective effects as well as its disease modifying effects. The ketogenic diet is a diet that has also been used for the treatment of epilepsy amongst children. And so I will be discussing its neuroprotective effect as well as disease modifying effects. A few years ago, J.M. Freeman conducted a study amongst 410 children with an average age of 5.5 years. And all these children were diagnosed with epilepsy, and they had an average of 6 seizures every day. And so these children were placed on the ketogenic diet. And after 3 months, 83% of these children were still on the ketogenic diet, and 34% of these children reported a 90% or more improvement in their seizures. After 6 months, about 71% of the children still remained on the ketogenic diet, and 32% of them improved by 90%. After a year, 55% of these children were still on the ketogenic diet, and about 27% of them reported more than 90% improvement in their seizures. The ketogenic diet has also been used to treat Alzheimer's disease as well as Parkinson's disease, and it has been beneficial. It also has antioxidant and anti-inflammatory benefits. And so in 1999, Lee et al. Explained that a ketogenic diet has been effective primarily because it's very low in carbohydrates. However, Rafiki et al. In 2003 said that there is a greater efficacy of the ketogenic diet amongst children compared to adults. And the reason is because a child's brain has a greater capacity to transport and utilize ketones as an energy source compared to an adult brain. Now, the ketogenic diet has some safety risks and concerns, and so it has been said that if you are on a ketogenic diet, it should be for a very short time. Also, this is because the ketogenic diet has been used for the purpose of weight loss, just like the Atkins diet. And so sometimes people tend to overdo, the ketogenic diet. And so after the body has lost most of the fat, it begins to use up the protein, and individuals on the ketogenic diet begin to lose muscle. And as well as the heart muscle, some scholars argue that the heart can be affected and so could cause serious problems for the individuals on the ketogenic diet. Also, people who are on this diet tend to be very fatigued, and also they begin to find it hard to lose weight because the body has gotten to its limit of losing fats and proteins. And so, the British Diabetes Association also points out that ketosis is potentially dangerous because, as very high levels of ketones can make the blood acidic, and so a state of ketoacidosis can lead to serious illness and really in a very short time. And so, the general consensus is it can do more harm than good, and so people who are on that diet should be on that diet for medical reasons, not primarily to lose weight. I was also curious to find out what the effect of the ketogenic diet is on brain tumors, and I found that it also has a positive effect on reducing brain tumors. And so, to conclude this video, I think the ketogenic diet is a very good diet for treating some medical conditions, but I don't think it's for everybody. I think it should be well monitored and should be for a short time. For references and to for further um, investigation to this topic, you can look into the references below this video. Thank you for listening.